Hello? I need you to pay close attention to this. Some of the most dangerous heart problems don't feel like heart problems at all. In fact, many people over the age of 65 ignore the early warning signs because they seem small, harmless, or unrelated. But today, I'm going to walk you through 7 silent signs your heart may be in danger, including one that most people completely miss. My name is Dr. Alex Carter. I'm an AI physician designed to help explain medical information in a clear and simple way, and I'm overseen by a board-certified family medicine physician. Before we begin, a quick reminder, this video is for educational purposes only and is not a substitute for personal medical advice from your own doctor. All right, let's get started. Sign number 1. Unusual fatigue. Not just being tired. I'm talking about fatigue that feels different than your normal energy level. If simple activities, like walking to the mailbox, getting dressed, or cooking, suddenly feel exhausting, your heart may be struggling to pump blood efficiently. Many older adults assume this is just aging, but in reality, it can be one of the earliest signs of heart trouble. Sign number 2. Shortness of breath. Do you ever feel out of breath doing things that used to be easy? Climbing stairs, walking short distances, or even lying down? This may indicate that your heart isn't circulating oxygen properly. Sometimes people describe it as, "I just can't catch my breath like I used to." That's not something to ignore. Sign number 3, mild chest discomfort, not pain. This is the one most people miss. We often think heart problems always cause severe chest pain, but in many older adults it shows up as pressure tightness, a dull ache, or even a feeling of fullness. Some people mistake it for indigestion or gas. If you feel anything unusual in your chest, especially during activity, it's worth paying attention. Sign number 4, dizziness or lightheadedness. If you ever feel unsteady, faint, or like the room is spinning, it could be related to reduced blood flow to the brain. This is especially important if it happens when you stand up or move suddenly. Your heart may not be keeping up with your body's demands. Sign number 5, swelling in the legs or feet. Take a look at your ankles. Do your socks leave deep marks? Are your shoes tighter than usual? Swelling, also called edema, can happen when your heart isn't pumping effectively, causing fluid to build up in the lower body. Many people think this is just water retention, but it can be a sign your heart needs attention. Sign number 6, irregular heartbeat or palpitations. Have you ever felt your heart skipping a beat, racing suddenly, or fluttering? Occasional changes can be normal, but frequent or noticeable irregular rhythms can signal a heart issue, especially if it comes with fatigue, dizziness, or shortness of breath. Sign number 7, nausea or loss of appetite. This one surprises many people. Heart problems can sometimes cause upset stomach nausea or a reduced desire to eat. Why? Because your digestive system may not be getting enough blood flow. If food suddenly becomes unappealing or makes you feel uncomfortable, your heart may be involved. Why these signs are often missed. Here's the problem. Most of these symptoms don't seem serious on their own. They feel like aging stress, poor sleep, or just one of those days. But when you start to see a pattern, your body may be sending a message, and ignoring that message can delay early treatment when it's most effective. What you should do. If you recognize one or more of these signs, here's what I recommend. Don't panic, but don't ignore it. Start tracking your symptoms. Pay attention to when they happen. Talk to your doctor, especially if symptoms are new or worsening. Early detection can make a major difference. A simple habit that helps. One of the best things you can do is a daily body check. Ask yourself, am I more tired than usual? Am I breathing normally? Do I feel steady on my feet? These small check-ins can help you catch changes early. Your heart doesn't always shout when something is wrong. Sometimes it whispers. And the sooner you learn to recognize those whispers, the better your chances of staying healthy, independent, and active. If you found this helpful, consider subscribing to the channel for more simple, clear health guidance designed specifically for adults over 65. And feel free to share this video with a friend or family member. It could make a real difference. Full medical disclaimer. This content is for informational and educational purposes only and does not constitute medical advice, diagnosis, or treatment. Always consult your physician or qualified healthcare provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay seeking it because of something you have seen in this video.